Tonight's topic, for those of you that can see it there, is frozen embryo blastocyst transfer or frozen worm blastocyst transfer after 6 or 7 days of progesterone. And so the basic question was, does it impact live birth? Does it impact miscarriage risks? What's the difference in the outcomes if you're doing 6 days of progesterone versus 7 days of progesterone? And I want to make sure we're clear about that. That's actually on the 6th day of progesterone administration. So you've completed 5 full days of progesterone, and then on the morning of the next day you're doing your transfer, so that you've actually completed 120 hours of exposure. It's not that you're taking 144 hours of exposure and then on the following day doing the transfer. In addition, they compared that obviously to the 7-day group. So very interesting study, and the reason these guys did it was in their facility they had actually published previously demonstrating there's no difference at all between 5 days of progesterone, 6 days of progesterone, and 7 days of progesterone. And so they wanted to go back and look at it again because there's so much data out there now saying, well, maybe the progesterone timing makes a big difference. This whole bit about endometrial synchrony being really important. Why aren't embryos implanting? Maybe it's because the embryo is at this stage and the lining is at that stage, and they need to be synchronized in order for you to have success. So the real question for all of these was, what do we need to do to get the optimal outcome for the patients? Should we use 6 days or 7 days? So there are some things about the study that are really critical. Number one, they did not do era testing. This was just protocol driven, where they took one group of patients and at one point did them for 6 days and then took another group of patients and did them for 7 days. So this wasn't based on personalized testing like the ERA test is. You guys have hopefully watched our other programs. There is one on our YouTube channel on the ERA testing. Someone always asks about that. So the answer is, to date, there is not a single study that shows a benefit to doing ERA testing, and that probably goes along with what these guys found, because they're seeing 5, 6, and 7 days actually made no difference, even in a randomized controlled trial that they ran themselves, where you were randomly being assigned to these different groups. So what they wanted to do here was a little bit different. They said, well, what if we break it down into its component parts and look at not just which day you got transferred, but what about how far or how long it took for your embryo to develop to the blastocyst stage. So the importance of that is, really robust, healthy embryos will often hit the blastocyst, and in particular the expanded blastocyst stage, by day 5 of creation. But sometimes it takes embryos a little bit longer and they can go to day 6. Now, there are many studies out there, some conflicting, which show that the day 5 embryos are kind of the baseline, they're the standard, and that day 6 embryos in many studies are just as good, whereas in other studies they're saying they're not quite as good. And then when you get to a day 7 embryo, they're saying it's definitely not as good, and all the studies agree on that. So in this study, they wanted to say, well, we're going to not look at the day 7 embryos, but is there a difference between these day 5 embryos and the day 6 embryos? So they looked overall at the study population, and there was 619 patients that underwent an IVF cycle. And so all of these patients at some point or another also underwent a frozen embryo transfer. So here's the first problem with this. Some of these patients went on to have fresh embryo transfers and then came back for frozen embryo transfers. So it's not quite a uniform group of patients. And anytime you're comparing two things, you really want to compare apples to apples. You don't ever want to compare apples to oranges. So in this particular instance, it wasn't an exactly fair contrast, and you need to know that, because when we're talking to you about studies, I got to validate the quality of the studies. So there is a little bit of a problem with the quality of that in terms of which groups were compared. The other problem is this was not randomized. This was a retrospective study, so you don't know what decisions went into why are we doing day 6 versus day 7, other than that they say it was just strictly protocol based on the timing within the years that they were studying this. So in one year they did one thing and in the next year they did another. So what they did was they broke it down into two groups. So group A included 346 patients who underwent a blastocyst transfer on the 6th day of progesterone exposure. So you've completed 5 days and you're into the 6th day, and that's when you're getting it. And group B had 273 patients with a 7th day. So you've now completed 6 full days of progesterone, and on the morning or afternoon, whatever, of the 7th day, you're getting your next cycle. You're getting your transfer. So to avoid bias, they only included one IVF-ICSI cycle, and it was only the first FET, the first frozen embryo transfer. So this wasn't after multiple failures, but again, you're missing out the patients who got excluded because they succeeded with their fresh embryo transfer on the first try. So again, apples and apples, not apples and oranges. So in terms of what they did, most of the patients underwent the same type of cycle in terms of management of growing the eggs. They all had reasonably similar development of the eggs, and they all underwent IVF and or ICSI. And again, if you're not doing exactly the same thing, it's kind of hard to say, well, is there a difference between ICSI and IVF? Now, they did subsequently control for all of these different elements when they did their statistics, and that's really important. You got to control for what we call confounding variables. So if you are going to compare apples to not quite apples or apples to oranges, but you want to relate it to the apples, you got to be able to control for the variables that make the orange and orange and the apple and apple. And they did do that. So they went through it all. And the other part that's important to talk about is that they used a hormone replacement cycle for the patients undergoing the frozen embryo transfer. So these are all programmed cycles where the patients are essentially getting medication to get their lining to grow. So they gave them estrogen to develop the lining and thicken it. And the protocol isn't really that important, but they either went oral or vaginal. And they did that for 7 days at one dose, and then they bumped it up a little bit higher for another 6 days. If the lining was thick enough, and they actually had a really low cutoff for thickening of the lining, it was only 6.5 millimeters. They then went on and started the progesterone. If it was less than 6.5 millimeters, they continued trying to thicken it by using extravaginal and a couple of other tricks. And if it still didn't work, they canceled that cycle and tried again. The progesterone they were using is also important. So as you know, there's lots of research out there that demonstrates you need progesterone in oil in order to get your serum progesterone level high enough. And then we also use the vaginal progesterone together with the progesterone in oil so that you make sure you're getting the right serum level of progesterone and the right intrauterine concentration. We found in our experience that's the best approach. Not everybody is doing that. A lot of places hate the pain that goes along with the injectable progesterone, so they avoid it, whereas other places only use the injectable, and you're not necessarily getting the same level in the uterus, and that's really important. So these guys only did the vaginal micronized progesterone, which here in North America we all refer to as Prometrium. And that's what they used in order to get it right. If they were using Lupron or a GnRH agonist ahead of time, they administered it on day 21 of the preceding cycle, which is pretty standard. Outcome measures were essentially live birth rate. That's the gold standard, so we're happy they looked at that. Okay, so when they first went to look at this, and I'm going to show you guys who are watching on the platforms where you can see it. For everybody else, I got to explain it to you, but we will show you. And it's right here, share. Okay, so I'm gonna just go this way and show you the data here. Okay, so the first thing is, are the two groups reasonably comparable? So they looked at age, the ages were the same. They looked at the BMIs were the same. Did they smoke or not? Ironically, between 16 to 19% of the patients smoke. So rule number one, if you're doing IVF, you're letting the patient smoke, you can virtually guarantee it's not going to work well because it is an 80% decrease in success. So very important that you not be smoking during your cycle. Same number of children, basically all the factors were essentially the same until you got to the very bottom. The duration of estrogen supplementation was just a little bit different in group B. That's the group that was waiting the extra day for the progesterone. So they were doing the 7-day group is group B. but it's only by just 1 day or just slightly over 1 day, which clinically is not really relevant. And the other thing that was different, which is important, is that almost double the number of patients in Group B, the day 7 group, had a double embryo transfer compared to Group A. So in Group A, 11.8% of the group had a double embryo transfer. That's the group doing it after 6 days. And in Group B, the 7-day group, 20.1%. So obviously you transfer more embryos, you're kind of skewing the results a little bit. They did control for it, and I'll go through that with you. But again, you want to kind of have apples to apples. And again, that's super, super important. Okay, so if you look at the other table, and that's this one on table 3. So a little bit of a confusing table, but essentially there were almost no differences when they controlled for all of the factors, except for when they actually looked at day 6 embryos compared to day 5 embryos. And there was a difference in the odds ratio of a successful outcome if you had a day 6 embryo implanted after only 6 days. And what that showed is that your results are down to 58% of what they would be otherwise, so it's a 42% decrease in success. The other thing that they demonstrated here, and I'll go down to the next table here, which is table 2. We're going a little out of order just because of the page structure. If you look down here, right in this category here, right at 0.05, so this is where statistical significance is achieved. And so this isn't actually statistically significant, but it's right on the borderline. You can see that the clinical miscarriage rate was a little bit lower, 10.3 versus 15.6, when you had the 7 days of progesterone versus the 6 days. This was univariable analysis, so they're just controlling for one factor at a time. When they went through that multivariable, it was different. When you look at the next part of this, table 4, the numbers that are really critical here for you to see is they compared the people with day 5 embryos and they compared the people with the day 6 embryos. So for those that can see the chart, the important part is here's where they controlled for everything. They took a look at it and they broke it down by day 5 versus day 6. And they don't have it in the actual study. They have a supplementary chart available. But in that supplementary chart, they actually did multivariable analysis where they're controlling for all those confounding variables and actually found essentially the same results, but even stronger. So here, when you're looking at the day 5 embryos, you can see here all the p-values, except for that very first one, which is actual pregnancy, between Group A and Group B are essentially not significant, except for when you get to the clinical pregnancy rate per frozen embryo transfer. You can see that it was actually higher in Group A than it was in Group B. So Group A had 58.3% if they took a day 5 embryo and they put it in after 6 days of progesterone. Or on the 6th day of progesterone, I should say. And Group B had a 48.8%, so 10% lower, when they put that in. The live birth rates, however, were not different. So even though your clinical pregnancy rate's a little bit higher, your live birth rate is still the same. And that's critical to understand because it's not just the clinical pregnancy that's important. The real important one, the gold standard, the holy grail, is that live birth rate. And that's the number we all always want to focus on. When you look at it in day 6 embryos, 2 things pop out. Here, the clinical miscarriage rate is way lower, almost a third when you're looking at the Group B, or I should say a half, sorry, when you're looking at Group B versus Group A. So if you had a day 6 blastocyst embryo and you had your transfer done after 6 days of progesterone, your miscarriage rate was 22.3%. versus only 9.7% in the group that waited till day 7. And that was quite significant. The clinical miscarriage per positive HCG, so per pregnancy test, even more significant, 50% in Group A versus only 21.4% in Group B. So what they're saying is, if you have a day 5 embryo, it really ultimately does not look like it makes much of a difference if you get the 6 days or the 7 days. You're going to literally get the same outcome, and there does not appear to be any difference. So you actually have some flexibility. You're not quite ready, you missed the timing, you need an extra day, you're still okay, you're fine to go ahead. But if you're a day 6 embryo, you actually may want to extend by 1 extra day of progesterone, because those embryos may need a little bit more progesterone the same way they took longer to develop. So maybe they need to synchronize with a lining that takes a little bit longer to develop. Down here at the bottom, you can see that the live birth rate in group A with those day 6 embryos was 21.5%. versus 35.5% in group B. Now this was a trend, so when you get anything from 0.07 to 0.05 in your p-value, that's called a trend, which means maybe it's justified, maybe it's the real deal, maybe it's not, they're not sure, but certainly merits further study. The neat thing about this study was, and again, I can't show it to you unfortunately because the data is not included in the main manuscript, so I couldn't access it, but they have a supplementary chart and they talk about it in the report, and they say that in that they actually did demonstrate a difference in live birth rate. And that's when they did the multivariable analysis where they're controlling for all those confounding variables. So they're saying if you have a day 5 embryo, it actually does not make a difference. But if you have a day 6 embryo, A, you might get less miscarriages, and B, you may get a higher live birth rate. What are the problems with this? Well, as I mentioned, the numbers are not huge in this study, so 619 is great, but it's not like an enormous number. We really want thousands when we're doing these important kind of comparisons where we're going to decide how much progesterone you should be exposed to and what the outcomes will be like. They didn't do apples to apples, and this is a retrospective study. So this is, hey, we ran a study or we ran some patients through. Let's look back and see what we did and see what the results were like. But that's not as good as saying, moving forwards, let's take, let's say 1,000 patients, and we're going to take 500 and randomly assign them to a group where they get 6 days, and randomly assign the next group to a portion where they're getting 7 days, and then let's measure what the outcomes are moving forward prospectively, because you get much better control, you get way reduced biases, and it doesn't have influences like, well, this doctor thought this and that doctor thought that, because you're kind of cherry picking the patients. So the fact or fiction this week is one of those complicated ones, and I always like doing the hammer and saying it's a fact, but the reality is this study is interesting, but I'm not prepared to start making decisions based on this yet. I think I feel comfortable, and certainly following these authors, they've already demonstrated in a randomized controlled trial that it doesn't really seem to make a huge difference with your garden variety embryos, whether you're going 5, 6, or 7 days of progesterone. But what is important is that this actually lends some support to the idea that maybe we need to be differentiating between the embryos that develop on day 5 and those that develop on day 6. Would I change my whole practice around this? No, I would not change my whole practice around this. But, sorry, someone's trying to call me. But would I allow this to continue and do more studies on this? Absolutely. Should we all be following, what ends up coming out of this? Yes. And I suspect that if these guys want to make a name for themselves, which scientists often do, they'll probably do that. They'll probably run this as a randomized controlled trial, or somebody else will, someone like Richard Scott, who runs these, juggernaut IVF programs where they can do that kind of work easily. So fact or fiction, is day 6 better than day 7? Not yet. It's a fiction that day 6 is better than day 7 or day 7 is better than day 6. But there is some interesting data there which would suggest that it is definitely a possibility that you may reduce miscarriage rates in day 6 embryos if you transfer them after this full 6 days of progesterone exposure on the 7th day, and that maybe it'll even increase the live birth rates. So that's fact or fiction. Remember, always like, share, comment. We definitely want all of you who follow us on Instagram, Facebook, Twitter to follow us on the YouTube channel. We really want to get lots of activity there because that's where we record all of our videos. They're all uploaded there. Make sure you go on there if you have any questions. There's all sorts of information information. We have our short little 101 kind of informational videos. We've got our endo video. Hopefully we'll be doing one on PCOS soon as well. And then all of our fact or fiction are updated there as well. So with that, I think we're going to start taking questions. I'm going to stop sharing the screen and we're going to go back to the video. So do you want to ask me first, or do you want me to look them up from here?
Take a couple from
Facebook? All right. Okay, yeah, I do. There's a million of them.